Welcome, nursing students. I'm Professor Rivera-Mitu, and today I'll be sharing high-yield, clinically relevant test-taking strategies designed to help you succeed on NCLEX and classroom exams. These techniques are especially useful when tackling next-gen NCLEX-style questions. We'll go through prioritization, pathophysiology cues, drug mechanisms, and core frameworks like ABCs and Maslow. Plus, I'll include sample questions after each tip to help you apply what you've learned. Let's go to our first test-taking tip. Mastering anatomy, physiology, and pathophysiology is fundamental because it helps you understand how diseases manifest and affect patients. Instead of memorizing every drug name, focus on drug classes and their mechanisms, which allows you to predict effects and side effects more effectively. Recognizing common prefixes and suffixes in drug names can help you identify their class quickly. Success on exams starts with understanding, not memorizing. Know your anatomy and physiology, especially organ systems like cardiovascular, respiratory, and renal, and use that knowledge to recognize signs and symptoms and anticipate complications. Remember, don't try to memorize every drug. Instead, focus on drug classes and learn common prefixes or suffixes like pril for ACE inhibitors or lol for beta blockers. Lastly, draw concept maps to link pathophysiology, labs, symptoms, and interventions. Concept maps are powerful tools that connect anatomy, pathology, symptoms, and nursing interventions, making complex information easier to recall and apply during exams. Here's our sample question. So this one is a drop-down closed type of NCLEX next-gen question. A patient with newly diagnosed type 1 diabetes mellitus presents with polyuria, polydipsia, and weight loss. Based on your understanding of pathophysiology and pharmacology, select the appropriate answers to complete the sentence below. So you will see that there will be 3 drop-downs on the screen. Unfortunately, I'm not able to create a drop-down button, but if you could imagine that if you click on this drop-down word, the words that are down below will pop up. So the question is, the patient's symptoms are caused by drop down 1, either hyperglycemia, hypoglycemia, or hyponatremia, due to insulin, and then drop down 2, resistance, deficiency, overload, and the priority treatment includes drop down 3, oral sulfonylureas, IV glucose, or insulin therapy. The correct answers: hyperglycemia for the first drop down, deficiency for the second drop down, and insulin therapy for the third drop down. So this is testing your knowledge regarding type 1 diabetes mellitus. The patient's symptoms, polyuria, polydipsia, and weight loss, are classic signs caused by hyperglycemia due to insulin deficiency. Understanding this pathophysiology guides you to select insulin therapy as a priority treatment. This exercise reinforces critical thinking by linking clinical presentation with underlying mechanisms and appropriate interventions, which is essential for NCLEX success. Thank you for watching. If you found this video helpful, please give it a thumbs up, subscribe to my channel, and share it with your fellow nursing students. Your support helps me reach more students and provide valuable content. Remember to subscribe to my channel to be the first to know about more test-taking strategies and concept map videos for different diseases. Remember, together we can make a difference in our nursing journey. Until next time, this is Professor Rivera-Mitu. Stay curious, stay compassionate, and keep learning. See you next time.